All right, good afternoon, everybody. My name is Peter Zanoni, Corpus Christi City Manager. We're going to begin our daily COVID-19 press briefing. This covers Nueces County and the city. I'll be speaking this afternoon, followed by Annette Rodriguez, our Public Health Director, and then Nueces County Judge Barbara Canales will be speaking as well this afternoon. We are going to talk about the statistics, including number of new cases, number of hospitalizations, number of deaths, and that will talk about some of the testing that's taking place, and the judge will be speaking as well later this afternoon. We want to thank the networks and media, the television, newspaper, radio for covering these events, these press briefings live. We want to thank the viewing and listening audience as well, and this information is important. We appreciate you using it and then sharing it with your family, friends, colleagues, co-workers, people you go to church with, and so on. Okay, so with that, let's begin. I'm going to show the number of new cases for today as our first graph, and it's not a good report this afternoon. We're reporting 502 new confirmed COVID cases for Nueces County, and that 500 number is the same number we had, pretty close to the same number we had a week ago Wednesday. So Wednesday on the 15th, we had 500 cases. Today, Wednesday on the 22nd of July, 502. And it's 213 more than yesterday, and more than the past couple of days running. We had been in the threes and the twos and in the ones, but we're back to that 500 number today. There's really no contributing factor. There was no outbreak area per se. The number of tests haven't jumped up significantly. So Annette may talk a little bit more about it when she comes up, but 502 new confirmed cases for today. On the chart that shows active cases to recovered cases, a little bit better news here. More persons are recovering than in the past couple of presentations that we've had with the community. So you can see in the orange, just under 2,000 persons have recovered who had COVID-19. That's about 21%. From yesterday, it's a gain of 700 recoveries. 700 more people have recovered today over yesterday. Yesterday we had about 13%. That orange slice was 13%. I guess it's not up yet. Today it's 21%. Just give it a sec to see if there we go. Okay, so that slice there is 21% of all the cases today on our totals for today. Yesterday, it represented only 13%. And so our cases have increased in the recovery area by 700, so we're just under 2,000 recovered. You can see, though, that we have over 7,500 persons that are in the active category. They haven't recovered, or they haven't passed that 14-day period, and that's just under 80% of all the cases. The number of persons hospitalized remains flat in terms of growth. It's the same number of yesterday, so 408 persons in the hospital. And then of that number, 134 are recovering in intensive care, in an intensive care unit at any one of our hospitals here. That's an increase of 13 persons over yesterday, where we had 121 yesterday. So 13 more today for a total of 134. And then our unfortunate statistic is the number of deaths. So that continues to climb. Today we're reporting 116 deaths in Nueces County since we've been tracking this through the pandemic. That's a gain of 8 since yesterday. So yesterday we had 108. And today we're announcing 8 more deaths. That brings our total to 116. And then our final chart is our running 7-day average time-lapse or time sequential graph, along with day-by-day counts. So this graph shows you the blue bars are the number of new cases per day, and then the orange-red line that's running is our 7-day average. You can see we kind of reached a peak and we began to decline yesterday, but with the 500 new cases today, the line kind of goes flat, or actually back up a little bit. So the 7-day average is 296 new confirmed cases. So today's 500 surpasses that 7-day average by about 200. Okay, so that concludes the update for today. Annette's going to do it, and the judges as well, but we need to continue to remind people to stay at home if you can. Wear your face mask whenever you leave the house. Even with your face mask, you need to social distance by 6 to 10 to 12 feet. Even with your face mask, you need to make sure you don't touch your face, your eyes. Don't adjust your mask too much, which can introduce virus into your eyes or your mouth or your nose. And keep your hands washed as much as you can. In between settings, use gel sanitizer if you're in between events and you can't get hot soap and water. The sanitizers are a good interim measure to keep your hands as clean as you can from germs, to include COVID-19. Okay, so that concludes my portion. Gabby's going to translate in Spanish, and then Annette Rodriguez, our Public Health Director, will speak next.
En las últimas 24 horas se han reportado 502 casos confirmados por el coronavirus. 1,986 pacientes se han recuperado por completo. 408 personas continúan en el hospital. 134 están en la unidad de cuidados intensivos. Esta es la cifra más alta que hemos reportado. 7,505 casos continúan activos. El día de hoy se reportan 8 fallecimientos. A la fecha, los fallecimientos totalizan 116 personas en el condado de Nueces. Queremos recordar que si no tiene que salir, quédese en su casa, utilice el cubrebocas, practique el distanciamiento social, no se toque la cara con las manos sucias y si no cuenta con agua, utilice los geles antibacteriales.
Good afternoon, Annette Rodriguez, Public Health Director. The Health District conducted our daily drive-through this morning. We had 165 individuals that went through to get tested, and we had 68 that returned as a positive result. That gives us a 41% in our drive-through today. First off, I'd like to take a moment to recognize the growing number of COVID-19 related losses that our community has suffered from. It has recently come to our attention that we have had several COVID-19 related deaths in nursing homes, state-assisted living facilities, and even have lost several of our local physicians. As mentioned prior, we have also had a handful of unusual occurrences in which we are finding individuals who have passed away from COVID-19 related circumstances within their own homes or recently upon arrival at the hospital. My sincerest condolences go out to the family members of these individuals. It goes without saying, these are highly sensitive occurrences, and we will do our best in preserving their privacy and dignity of the surviving family members. We believe in the importance of arming the public with as much pertinent information and knowledge as possible. With that being said, we also respect that hospitals are being overwhelmed with cases and must dedicate the bulk of their resources towards the #1 priority of saving lives. In the meantime, we are collecting daily information from our hospitals on deaths, including ages and gender. The culmination of this data will serve to help us further understand the evolution of this disease as we continue to try and stop the progression of the disease. As the impact of COVID-19 continues to be felt throughout the community, the question that I get asked more and more often is, what else can I do to protect my family and keep us all safe? For months now, I have asked people to wash their hands and continue their commitment towards social distancing. The struggle that we face today is adhering to these changes and working in continued unison. We achieved terrifying heights in our COVID-19 cases after the holiday celebrations and graduations. It is completely understandable that the community is feeling stir crazy and wants to go out and celebrate. Truth be told, all of us would love to take a break from COVID-19 and go celebrate with you. Sadly, that day will not come unless we all work together in bringing these numbers down. I ask each and every one of you to recognize that many essential workers have been overwhelmed since the very start of this pandemic. They are exhausted and they continue to move forward in an effort to keep this community running. In addition, the vast majority of them are wearing masks for their 12-hour shifts. It is only fair that we respect those sacrifices and follow best practices to ensure that we do our part. On that note, we will continue to remind you of the importance of washing your hands and wiping down frequently touched surfaces where you can. Wear a mask when frequenting public spaces and be mindful of keeping a 6-foot or more gap whenever possible. The only way that we can hope to regain a sense of normalcy is if we all move forward in solidarity. Stay well, stay protected, and as always, stay informed. Thank you.
El Distrito de Salud llevó a cabo hoy la toma de 165 muestras, de las cuales 68 fueron positivas, dando un porcentaje del 41%. Queremos reconocer el creciente número de pérdidas humanas en los días recientes vinculadas a complicaciones por el virus. Estas han ocurrido en hogares de ancianos, centros de vida asistida por el Estado e incluso varios de nuestros médicos locales. También hemos visto reportes inusuales como personas que fallecieron en sus hogares o recientemente al llegar al hospital. No hace falta decir que se trata de hechos muy delicados y haremos todo lo posible para preservar la privacidad y la dignidad de los familiares sobrevivientes. Sabemos que es importante reportar al público información, incluyendo edades y género de las pérdidas humanas, pero la prioridad de los hospitales ha sido la de preservar y atender a los pacientes críticos. Mientras las secuelas del virus continúan afectando a nuestra comunidad, la pregunta que la gente se hace más seguido es: ¿qué más puedo hacer para mantener a mi familia segura? Durante meses hemos pedido a las personas que se laven las manos y continúen su compromiso con el distanciamiento social, y ahora parece estar dando más resultados. Hemos alcanzado cifras aterradoras en nuestros casos de COVID-19, especialmente después de que la gente ha celebrado por muchos eventos, pero la situación no va a mejorar hasta que todos trabajemos juntos. Les quiero pedir a la comunidad que aprecien que muchos trabajadores esenciales se han visto abrumados desde el comienzo de la pandemia. La gran mayoría de ellos utiliza cubrebocas para sus turnos de 8 horas. Es justo que respetemos esos sacrificios y sigamos las mejores prácticas para asegurarnos el hacer nuestra parte. Por lo que continuaremos recordándole la importancia de lavarse las manos y limpiar las superficies que usan con mayor frecuencia, usar un cubrebocas cuando esté en lugares públicos y mantenga el distanciamiento social de al menos 6 pies.
Gracias, Gaby. Barbara Canales, Nueces County Judge. Well, my talking points today are focused on something that I need everybody's help with in the community. We are almost 2 months into hurricane season, and when the weather is calm, sometimes we tend to let our guard down. We certainly have had enough to worry about, haven't we? But unfortunately, on a call this afternoon, the National Weather Service has gotten my guard up. When the coronavirus pandemic has turned our world upside down, we have really been in emergency posture at the county and at the city since mid-March. And while we've been combating this unbelievable invisible threat that is COVID-19, sometimes you can forget that we live in a place where we always face enormous threats this time of year from the very thing that we love so much in the coastal bend, and that's our proximity to the Gulf of Mexico. I know you have many, many questions about how we will handle those who are hospitalized with coronavirus, those in the ER, those vulnerable amongst us, and particularly those who are quarantined at home because of a positive test or exposure to somebody who's tested positive. And because of all of the events that have been transpiring in the Gulf and the Atlantic, I believe it's necessary to coordinate a full presentation on this topic. And there are many entities involved, and we're going to have to gather our resources, the county, the city, health department, hospitals, emergency responders. And I would like to tell you that this will happen very, very soon. I would love to say I could do it tomorrow, but I need to gather everybody's inputs on schedules. But I will tell you that we will make sure that this presentation is available to you very quickly. In the meantime, the county and the city recommend that everybody review the CDC Hurricane and COVID-19 Guide. And this can be found on our websites. We have excellent websites that have really good links to information. And so for those of you that are interested, what the CDC recommends, it's posted. I'm also going to make sure that we're posting all our hurricane preparedness links and messaging to our social media platforms. But much of what we do for handling our COVID patients won't be that different from how we handle those in the hospital or those who require dialysis, those who need medications, who require oxygen. So what I mean by that is that the mechanics of how we approach emergencies are the same, with the same fortitude, with the same laser focus, with the same commitment to keeping public safety number one. It's a matter of scale. And yes, there will be some new challenges, but these are challenges that we have some prepared for and even drilled for. I'd like to review basic hurricane preparedness with all of you right now so that you can make sure that you have this in your mind. It might sound just like coronavirus. It's be prepared and stay prepared. Know your risks and sign up for our reverse alerts. I believe our reverse alert system is second to none. I think it's an amazing technological system that allows us to use the telephone as a way to receive valuable and important information. When I was a young girl, it was a radio close to our ears. Now it's a cell phone close to our ears. And that reverse alert is invaluable. You're going to get the latest updated information. Of course, we want you to watch the local news, and I want to thank the news that's always here to help us get the word out. We really rely on you, and I appreciate you, ladies and gentlemen, that are always here with us at our press briefings. So I want you to gather the right supplies and not hoard, but gather the right supplies. Keep in mind your needs for 3 days. This is what we recommend, 3 days needs. We stock up on items like non-perishables, first aid supplies, prescriptions, pet supplies, flashlights and batteries, and don't forget to charge all your electronics that you might need. You should have your go-to personal kit. This is a kit that is going to help you with COVID-19 or with hurricane preparedness. It includes hand sanitizers, face masks, wipes, and soap. I want you to secure your documents. I want you to remember to keep copies of important personal documents and make sure that they're put away safely. And I want also that if you have any filing for government assistance that requires documentation, that you protect those. Again, keep things that you need safe in a secure location. And if you have to evacuate, if that is called, take them with you. Protect your property. Shutter your home as needed. Review your flood insurance policies. Declutter drains and gutters. All the good things that we always know about living on the Gulf Coast. And also, your flood insurance doesn't take place until 30 days after you purchase. So make sure that you're maintaining up-to-date information about your policy. We all say have a plan ready. That's that preparedness. So you want to familiarize yourselves with routes, particularly those of you that live on the island in Port Aransas, and also shelter locations. I think shelter locations are going to be more important than ever this coronavirus season. We may have to do things differently in the future, but we're going to be discussing and practicing these drills for evacuation with your family. Talk to your family, talk to your kids about how important it is to heed governmental warnings when it comes to public safety. It could be a mask that we talk about at the dinner table today, or it can be making sure that we have our family plan tomorrow for evacuation from a storm. Your city and county have very strong, robust emergency plans. And the biggest part of our plan is you and your preparedness. So it's part of life here in the Coastal Bend. Some risks are assumed. We knew that there could be storms in the Gulf. Nobody knew about the storm that was COVID-19. And maybe you hate to hear about the possible business of COVID-19 and a storm in the Gulf. But let's focus our attention on all that we can do, all that we can control in our personal lives to combat the spread of coronavirus and to be prepared for a storm in the Gulf. I always tell everybody this at my house. I'm really looking forward to the true sunny days ahead. the kind that fill your face with the joy that we once knew when we weren't wearing masks and we didn't think about thunderclouds called COVID-19. My friend said to me, I feel like it's raining COVID-19. But there is a calm after every storm. And the most important part of being inside of a storm is getting to safety. I know we can do this together. I feel confident about the plans that we have forged in the past. I feel good about the resiliency that we have learned from our previous history. And I know that there will be sunny days ahead. And so I thank you for the opportunity to drill a little bit about the storm that I see that was over Cuba last night and that looks like it has some good chance of coming into the Gulf of Mexico, and particularly the Western Gulf. And so I want us to be strong and I want us to be prepared, and I want you to be sure that you are listening to your media outlets, and we will make sure we bring you up-to-date, accurate information to guide you through these difficult times. Remember, we always talk about changing the course if the winds blow in a different direction. If they choose to blow our way, we'll simply adjust our sails. Thank you so much. I look forward to your questions after the briefing.
En resumen, ya estamos a 2 meses desde que comenzó la época de huracanes. Mientras hemos estado ocupados con esta pandemia, no se nos puede olvidar la época de huracanes y qué vamos a hacer para cuidar de aquellas personas que están en el hospital. Vamos a contar con todos nuestros recursos, vamos a reunir a todas las agencias del condado y de la ciudad. Mientras hacemos eso, le pido que revise las recomendaciones del CDC en cuanto a estar preparado para los huracanes. Recuerde, su seguridad es lo más importante. Esté preparado. Le pido que se registre en Reverse Alert, así podrá recibir información importante mediante su teléfono celular. Mantenga los recursos necesarios sin comprar de más, lo suficiente para 3 días, desde comida, agua, medicinas, etcétera, lo esencial. Recuerde tener sus documentos personales, tenga lo más importante con usted. Tenga artículos que no, remueva artículos que no necesite en su casa. Si cuenta con seguro en su hogar, tenga a la mano esos documentos. Vamos a discutir también las rutas de evacuación en caso de que sea necesario. Hable con su familia y tenga un plan. Enfoquemos nuestra atención en lo que podemos hacer y esté preparado. Nadie sabía que ocurriría una pandemia, por lo que sí sabíamos es de que cada año tenemos la potencialidad de un huracán. La tormenta que se encuentra al norte de Cuba entrará al Golfo de México. Recuerde estar preparado. Asimismo, si se quiere registrar en Reverse Alert, lo puede hacer a www.reversealert.org.
Okay, I did want to acknowledge that Mayor Joe McComb is here, but he doesn't have any comments today. But we do thank him for being here and listening, and for being the policy leader of the city as the mayor. That concludes our press briefing for this afternoon, so we're here to answer any questions that the media might have. Judge, okay. Call the Times has a question.
Yes, sir.
So yesterday, the UIL announced their guidelines for returning athletics.
Yes.
Will Nueces County allow schools to practice and have games in August, even if schools are not in person?
Right. So as a matter of fact, I was on a big call today with the Education Service Center, number 2, and I promised them that I would be seeing Ms. Rodriguez today, and that she and I and Dr. Ram, along with Mayor and Manager Zanoni, need to have this conversation tomorrow. We do believe that right now face-to-face instruction is not safe, and that's why that local health authority deemed it to be in the best interest of school children to have remote learning until after Labor Day. I think the most important thing that we can do is see where the numbers and the data drive us. I personally suggested that strength conditioning and training can be implemented possibly in a way that's individualized, and that could be good for the mental health and wellness and exercise, strong mind, strong body for our children, but that I had deep concerns about how we were going to figure our way out into contact sports. I didn't see that today would be welcoming for that. But I am not the health authority, and so I want to defer your question to tomorrow when I've had the chance to visit with him. I didn't do so today because, quite frankly, with 500 cases, 8 deaths, and increasing ICUs, it's just been a brutal day. And I also want to share with you that I'm very proud of the schools and the school districts and the leaders. I got such incredibly thoughtful questions. Their concerns are for your children. And I just think it's so wonderful. I also told him how much I love sports personally. All my children were involved in multiple UIL. I had kids that played at the college level. Sports not only define us in many ways, but they reveal character. And I suggested then that we often talk about millennials and maybe some shortcomings. I think just the opposite. I think this generation learning how to live with sacrifice, if we do our job right, we're about to parent, if you will, probably the greatest generation that we could ever imagine, because this is a true new great generation that's coming forth, having to learn how to battle all of these different things. So UIL, excellent question. I think where I'm leaning to is leaning on the health authority. And I hope that you'll give me that chance to, this came down last night, so I hope that we'll get back to you tomorrow, Courtney. But you can see all the tangled webs that could create with contact sport. Follow up? Okay.
Well, not a follow-up, just,
Oh, okay.
as far as that testing that you said was gonna start over, at the fairgrounds,
Fairgrounds?
will the county be securing the supplies for that? Or will the
Yes.
company be supplying them?
So that's a good question. So I believe this is kind of what I call a turnkey operation, the way we had MMT, military testing. It's my understanding that we do what we always do, which is we secure the location, we secure some of the logistics, and when I can figure out how to, sometimes feed those good men and women that are doing it, sometimes we get involved with that. But for the most part, it's turnkey operation and it is established by the Texas Department of Emergency Management. And that'll take place from July 27th through August the 2nd. I'm looking for a flyer from them to hit our social media as soon as possible. I asked for it yesterday. I'll be sure and release it to the media. This will be a special flyer that will tell people how to sign up. Thanks. I did learn that this testing, as I told you yesterday, was saliva, but I learned a little more. You do your cheek on one side, cheek on another, and your tongue. So for those of you that were very squeamish about the swab in your nose, relief has come. You can now get tested without any fear because there's nothing wrong with the little swab in your cheeks and on your tongue. And this will be a very good new method of testing that we hope has very high efficiency rates.
Our daily numbers, are we counting antibody and antigen tests along with the nasal swabs?
That's a great question. So the question is, for our daily numbers, are we counting the antibody and the antigen? So our numbers were like less than 300 for many months. I think we remember that. And then in June, we went over 2,000 in cases. And then in July, we boomed and we went over 6,000 in cases. And so the answer is yes, there is all the numbers, all the positives coming in are all being counted. So they might be antigen, they might be antibody. So recently, the last couple of days, the state has asked us to try to separate out any antigen and any antibody test. So what we're currently doing as of today, a couple of hours ago, we actually we had 10 antibody tests that were positive. But because we don't know if they actually meet the clinical diagnosis to count it, we've taken those 10 and set them aside. They're still going to be reported to the Department of State Health Services. And the antigen test, we reported separate to them as well, and then the total cases. So for the total number today, we report it as one total number, so you see it as whatever the number is. But there are some antigen swabs in there, and the majority are the PCR. Great question. Thank you.
Okay, I think that's it for questions. Any more questions for today? Okay, very good. Well, we appreciate the public watching, and we thank you for the media that's covering our press briefing today. We'll be back tomorrow at 5 o'clock. We'll see you all later. Thank you.